Hi, my name is Michaela. I'm going to be demonstrating the nasogastric tube insertion as well as the irrigation. Before I enter my patient's room, I'm going to check the doctor's orders against the MAR as well as the patient's medical history, looking for anything that would indicate that the patient cannot receive this nasogastric tube. I'm going to gather my supplies, which include a basin, a water cup, some gloves, the tubing, some tape, a 60 milliliter syringe, a towel, a safety pin and a rubber band, and tape. I don't know if I said tape. And so I would go into the room. Hello, my name is Michaela. I'm going to be your student nurse. Can I have you tell me your name and your date of birth? That matches the wristband. And I'm going to raise the patient's bed to a comfortable height. And grab on him. I'm going to raise the patient to a high powers position. Lower this. And I'm going to adjust my patient because he is sitting really low on the bed. And I'm going to first start by checking the patient's oral cavity as well as his nares for anything that would obstruct the nasogastric tube. So I would check his oral cavity, there are no obstructions, and I would check his nares, and there are no obstructions. So now I'm going to determine which nair would be more appropriate for the nasogastric tube to go into. So I'm going to have the patient occlude one nair and breathe in, and occlude the other nair and breathe in. And for this particular patient, the right nostril is more appropriate. He could breathe easier in the right nostril. So I'm going to get my tubing and I'm going to measure out the length. Or before I do that, actually, I'm going to rip up off 4 pieces of tape. One of them is going to be the indication, or I'm going to attach that to the tubing, which would indicate the length that I need to go in. You can also use a Sharpie for this, but I'm just going to use tape. So I would get my tubing and I would measure from the tip of the nose to the ear, and then from the ear to the xiphoid process. And so there is where I would mark my tape, or mark my spot with tape, or you could use Sharpie. And so I'm going to set the